Trendelenburg, this is the function that excites me. We feel it's underutilized, and we feel that it provides the most benefit for the clients. And it's really wide ranging. We find that a lot of clients will tell the dealers or yourselves that they don't need the Trendelenburg. It's seen as maybe a clinical function, but we'll talk through some of the reasons. But it's even beneficial for any client that needs to be able to sit up in bed. And we'll show you some of those really key benefits in using this function.
So just about what Trendelenburg really is, for those that don't know, would probably credit with most with knowing.
Yeah, that's good.
But it's basically flat tilt of the whole bed. So the 333 can do both for reverse Trendelenburg, which is the position we just showed there, and then actual Trendelenburg, which is tilting back towards the head end.
It's good. It's brilliant. So as we just covered, seeing it like that just seems, why would I use the bed? You often get a client who says, why would I use that? It's not something I need. But understanding that if you use it in conjunction with the other functions, there's a lot of benefit there. So starting with repositioning, you might have a client that struggles within in-bed mobility. So if let's say they've migrated down to the foot end of the bed, you can now, or they themselves can use the Trendelenburg position for ease of bringing them back to a better position in the bed, or a carer, rather than struggling to bring might be heavier clients up the bed, down the bed. Use Trendelenburg to assist. That can be really beneficial. Fluid management, this is a more traditional benefit of using the Trendelenburg. So it might be edema or fluid buildup in the leg area. You can elevate the legs using the Trendelenburg, and then you might raise the torso, as you can see there, the head lift. So it's a more comfortable position to be in, yet you've still got legs elevated. You could use the knee break there for a bit of comfort as well, but very beneficial for fluid management.
Yeah, there's really infinite positions that you can use when you combine Trendelenburg with your headrest and knee break.
Yeah,
it's very versatile.
So much more than just a flat bed when you start using these other functions. So this is a good one we've talked about, and we've proved this so many times, is using the Trendelenburg for transferring on and off the bed. So we can talk through some of this.
Just a small disclaimer here, that is me, and I'm not disabled, but this is just for demonstration purposes only, just so that no one gets angry in the comments. So this is basically demonstrating a wheelchair transfer into the bed, and how you can set the bed at the correct height, and then this portion of it here is how you can actually use the Trendelenburg function to transfer back out of the bed from a mobility aspect. Sorry.
No, that's good. That's brilliant. I like to just cover, see the bed in that position there, with the head raised, elevated, your knee break position there. It's essentially now become a recliner chair. You can imagine sitting in that bed, you're upright, your positions, it might be for reading, for eating, for any need to be able to be seated in bed. This is so much more comfortable than if the bed was flat. If you imagine we level the bed out now, your feet are up, and you squeeze now through the torso, where this is a seated position with your feet down at floor level, really beneficial for any client that needs to sit up in bed. Even if it's not quite taken through to that angle, take it back a bit, still a lot more comfortable than using the bed flat. So that video, I think we probably covered it pretty quickly there, but showed the client being able to get out of the bed using that Trendelenburg because their feet are at floor level. It's a lot simpler to swing their feet around. The video showed in brief, but to swing their feet around onto the floor, they're at floor level already, and you're at a good seat height. You can also take, as the client showed there, you raise the bed, it takes the client into a standing position. So using that remote, the client assisting themselves, very, very beneficial for side transfers and ease of getting in and out of bed.
Yeah, from someone who is restricted in their mobility, it's a brilliant and probably understated way of using it.
Yeah, definitely.
The other way you can actually, this is probably a little bit of a side note, but we get a lot of requests about, cardiac chair position. And that's another way that you can actually use that combination of features, is using full head lift and knee break, and then full reverse Trendelenburg. So tilting the bed right forward, and it's really good for, cardiac, assisting with those cardiac patients as well. So just a little side note there.
Yeah, I really like to emphasise that. Showing a client that is often, you might say, a light bulb moment. They say, "Wow, that takes away my lift chair, my recliner chair." And the fact that I can sit up in bed like that.
And if you're in a showroom, like if you're in with a client at the showroom, you might have to demonstrate this to them.
Yeah,
because it's quite hard to just talk about and expect them to understand. So walking them through the process, it might take you, another 5 minutes, but it's well worth it.
Yeah. Like even I've seen examples where they'll do this but leave the knee break down, just think, okay, use the head lift, and then they're straight out of bed. So it's important that you're using all of the functions. So use the knee break. It stops the client moving down, provides it support through your lower legs, thighs, and then lower legs as well. And then obviously the Trendelenburg following that. So I trust you can get the picture from their video, but I love this benefit here. It is proved time and time again beneficial for clients. So last point here around Trendelenburg is using it for pressure care, and this can be quite effective. So for the prevention of pressure injuries, and it's really about shifting a client's gravitational pressure points. So we have our common areas of pressure through your lower back, sacrum, thighs, ankles. And we can shift those gravitational pressure points by just changing the angle of the bed. So you can imagine your gravitational pressure points. This will show you in some form. But if we change that angle, you see as we're shifting the beds, so using the Trendelenburg, you can imagine it's shifting that. That's maximized. That's shown it in the extreme case. But it only takes a small, incremental change to shift that gravitational pressure point just off that direct point. And so what we recommend here to really assist is actually incremental changes. Like we recommend 10% every hour, but obviously it's going to change to a client's needs and their pressure rating. But just those incremental changes, even partial changes every now and again, within 1-2 hours, or it might be twice a day, just shifts those gravitational pressure points and reduces that risk.
Yeah, well, I guess one of the key things here, and in that demo, I was using some of the other functions as well, but you can use it in a way that mitigates shear. And by what I mean by that is you would set the bed up, let's say with X amount of 15 degrees of head backrest tilt and maybe some leg elevation as well, and then through the knee break. But then the idea of using the Trendelenburg for pressure care is really around mitigating that shear. So not having to change those angles reduces the skin shear, but still gives you that gravitational change, as you're saying. Yeah. Does that make sense?
Yeah, that's good. Absolutely. Using those functions as well can be beneficial. And I think it's worth the way you can experiment with this. If you've got the time when you go into a showroom next, if you've got 15 minutes, go and lie on the bed, use those functions, and then after 15 minutes, just change that angle. It doesn't even take that long, to be honest, but you can just feel that shift. So through your common areas of pressure, lower spine area, just shift that, and you'll feel it just shift down, even if it's only 5 centimeters. That just shifts that pressure off that pressure point.